Thank you, Abigail, and good afternoon to everyone joining us from across Europe and beyond. It's my great pleasure to welcome you to today's webinar From Token to Table, Making Youth Engagement Count. Thank you so much for taking the time to join this discussion on a topic that is increasingly recognized as essential for the future of health policy, and that is meaningful youth engagement in the prevention of non-communicable diseases. My name is Katja Cic, and I'm delighted to chair today's session organized within the EU Health Policy Platform. And over the next hour and a half, we will explore how youth participation can move beyond symbolic inclusion towards real influence in shaping health policies and actions, outline a few lessons learned, and see if any best practices in the field already exist out there. Now, non-communicable diseases, including cardiovascular disease, cancer, chronic respiratory diseases, diabetes, and many others, remain the leading cause of death and disability in Europe. And many of the behaviors and exposures that influence NCD risk begin very early in life, with socioeconomic, commercial, and other determinants of health having a large impact throughout the life course. That means that young people are not only affected by NCDs as a future generation, but are already stakeholders in prevention today. Yet, despite this reality, youth voices are often underrepresented in policy discussions and governance spaces about NCD prevention. And too often, young people are invited to consultations, but are not really given a meaningful role in shaping discussions. That is precisely the gap that we hope to address with initiatives like the EU Health Policy Platform Thematic network called Youth Chapter on NCD Prevention. Now, allow me to briefly share the story behind how this initiative came about. And on the screen, you also see the QR code in case you're interested to join us on the platform itself. Over the past few years, many organizations working in health and NCD prevention in general have recognized that sustainable change requires stronger youth leadership and participation. And you might have heard of some of these organizations like the World Health Organization, the OECD, European Economic and Social Committee, and of course, the European Commission. At the same time, young advocates across Europe have been increasingly active on issues such as healthy environments, mental health, tobacco control, and sustainable food systems, just to name a few. And within the EU-funded project Joint Action Prevent NCD, partners began discussing how to create a sustainable space where youth perspectives could be systematically integrated into the work of the NCD community in the European context. So, rather than engaging young people just occasionally, the idea was to establish a thematic network within the EU HPP, aptly named the Youth Chapter on NCD Prevention. And it's a dedicated mechanism that enables intergenerational exchange where young people can contribute ideas, challenge existing approaches, and also help co-create solutions, while older and more experienced experts can champion the youth, learn how to work with them in a meaningful way, and offer institutional support. So the goal of this youth chapter is simple but powerful: to move youth engagement from tokenism to partnership. That means ensuring that young people are not just present in the conversations, but that their insights genuinely shape the direction of policies, advocacy, and implementation. In short, it is for those that are young and those that are young at heart as well. So today's webinar is a part of that effort. We hope it will provide a space for learning, inspiration, and exchange, bringing together policymakers, public health professionals, civil society organizations, and youth representatives who are committed to strengthening youth engagement in NCD prevention. Now, let me briefly walk you through what we have planned for today. You have just heard a short overview of the youth chapter on NCD prevention, including its objectives and how stakeholders contribute to its development. Following that, we will hear from a distinguished group of speakers who bring perspectives from policy, public health, and youth advocacy. They will share experiences on what meaningful engagement looks like in practice, what challenges remain, and how we can work together to ensure that youth voices are truly heard in health policy processes. We will have the first speaker, Arnfinn, discuss his experience involving youth in the Co-Create project that was coordinated by the Norwegian Institute of Public Health, what were some ups and downs they faced, and what the Institute and its experts learned from youth. The second speaker, Sophia, will touch upon the process of establishing a youth advisory group within Joint Action Prevent NCD, and what was it like being active in the JAG over the past year. And last but not least, the third speaker, Mehitabil, will tell us about the efforts of the European Heart Network in creating their own spaces for meaningful youth engagement and what lessons were learned. After these presentations, we will open the floor for questions and discussion, which will be facilitated by my colleague Urška Erklavec from the National Institute of Public Health in Slovenia. And we warmly encourage you to participate, share your reflections, and contribute to this collective conversation. You can already add questions in the chat during the keynote presentations, and we will call on you once the Q&A starts. And then to wrap up the webinar, we will also discuss the drafting of the joint statement, where we will be joined by Carlos from DG Santé, who will help us explain the process. Now, before we begin, I would like to express our sincere thanks to all of the speakers, members of the youth chapter, and the EU HPP team who helped make this webinar possible, as well as to all of you joining us today. Your engagement demonstrates a growing commitment across Europe to building more inclusive and forward-thinking spaces for co-creation of healthy environments and stronger health policies by including the youth. With that, let us move into the program. It is my pleasure to introduce our first speaker, Sophia Bergqvist, who will help set the stage by sharing the insights on the joint action and youth integration into it. Sophia, the floor is yours.
Hi, thank you. So as mentioned, I will be talking as the Youth Advisory Group member, talking about how it is important, how youth has been meaningfully engaged in the Joint Action Prevent NCD project. So first of all, I just want to mention that there are multiple different degrees of youth engagement, and these are things that have been put into place by the Joint Action, and starting from youth consulted. So we go to youth and we try to understand what we can do with them, all the way to getting youth as leaders, as people who are front runners in their projects and who are advancing their own agendas. And this happens through strategic planning, being active, producing knowledge, and also generating and co-creating with the experts in the projects. And we as youth are not only seen as young people, but we are actually youth experts in our own rights, in our own domains, and also as our own stakeholders. So an example, a very good example of how to meaningfully engage youth was last year at the Wellbeing Economy Forum in Reykjavik in Iceland. We were invited as the Youth Advisory Group to participate in the forum, something that we didn't actually know at first was that for every panel, there was going to be a youth representative on the panel talking and representing, being a representative. So it was it was a way of promoting inclusiveness and also an intergenerational dialogue between policymakers and other stakeholders. Something that was actually a very nice surprise was that young adults, young professionals were giving bigger responsibilities and opportunities. As you can see in this picture, the woman on the right is my colleague, Sylvia. She was asked to be one of the moderators and talk to Iceland's president, Halla Tómasdóttir. This is another way of creating an intergenerational dialogue, and which also helps facilitate co-creation. And how is this possible? This is a shift that has been made possible through different points, mainly supportive coordination. Our coordinator and the whole of the work package number 4 of the joint action are very much on our side. They are actively advocating for youth representation, youth involvement, and also just our presence in all, or at least as many conferences and opportunities that is possible. Another thing is that strong communication. This happens through internal and external structures. And as you can see on this picture, there's a few images of our meeting, our work plan meeting that happened last year in Katowice in Poland, where we as youth decided what our priorities were, in what direction we wanted to build, and also create an internal and external structure that helps create sustainable practices. And also, this happens through diversity and inclusivity. The Youth Advisory Group is a group of around 30 young professionals, young students, and just young people from different backgrounds, different from different regions of Europe, from different cultural backgrounds, different ethnic, religious backgrounds. Also, there's a diversity in age, in gender, and disability. So we are trying to have as an inclusive and diverse panel as possible, because as we are only a small group of people, but we're trying to represent as many people as possible when possible. As you can imagine, it has not always been very easy. There have been some challenges that we have faced. For example, we have battled time and budget constraints. This has happened mainly for young adults and young students who do not have the means to travel to conferences and travel to all the internal, external meetings, because, well, we are not always thought of when these meetings are put in place. And this also comes in with limited budgets, so we're doing our best with what we have. Another thing that happens is late and limited inclusion. This happens when this kind of limits the potential impact of youth contributions, because youth has mainly been seen as an afterthought. But this is now also changing, which is great. But even as the Youth Advisory Group, we have been asked to lend our expertise to some pilots and other projects that have already started or that are already going on, and it would be more beneficial to be included from the start. And this would be as a good practice to directly include youth from the beginning when the implementation and just the strategic planning is being held. But even with all these limited resources, youth is making strides. Finally, I would like to share some practical recommendations on how to make youth participation more impactful and sustainable for future NCD and broader EU health initiatives, drawing from both our successes and lessons learned along the way. So, for example, there is the Safe Hearts Plan. The Youth Advisory Group has been mentioned by name in their report. They are saying that Youth Advisory Group, just the fact that we have been active in online consultations organized by DG Santé, this gives youth and young people living with or at risk of cardiovascular diseases, as well as youth advocates, an opportunity to directly share their experiences and expectations with policymakers. This then led to a higher level communication with policymakers and incorporates the experiences of youth and helps co-create meaningfully together. Something that we have also heard in one of our last meetings was from a pilot. The leaders of the pilot, they mentioned that we thought it's always a good idea to get feedback straight from the youth. So these are small things that are making a difference, and these are also small things that are making small differences for us. We are more included, we're more meaningfully engaged, but also we are creating more sustainable structures that will outlive the project and create change on a broader level. And as I mentioned, the youth are making strides. We are gaining traction, and there's a bigger demand for youth. It's not always easy. It's not always as straightforward, but it is very rewarding when it happens. So thank you very much. If you have any questions, please don't hesitate to contact Katja Cic after this or via email for more information about the Youth Advisory Group. But yes, thank you very much.
Thank you, Sophia, for highlighting your experience within the Youth Advisory Group of the Joint Action Prevent NCD. If there are any questions for Sophia, please feel free to drop them in the chat and we'll get back to them later. And now we will continue with the co-create experience. So I would like to welcome to the stage Arnfinn from the Norwegian Institute of Public Health to tell us a little bit about the experience the Institute had working together with youth on the project of confronting obesity and co-creating policy with youth that ran over the space of 5 years before the Joint Action Prevent NCD started. And how was your experience with youth? Arnfinn, the floor is yours.
Thank you, and also I'm sorry that I missed up the timing here. So I thought we started at 3, so that's but let's see if I can find the presentation here. So as Katja said, my name is Arnfinn. I work at the Norwegian Institute of Public Health. We had this project co-create going for 5 years. And this was a project targeting youth involvement, obesity prevention among youth in European countries. So let me just see if I'm able to, even though we practiced yesterday, I'm not familiar with where do I find my screen. Do you have it somewhere else that I can put on?
So you can either share your screen. At the bottom of the screen, you should have the option share.
Yes. Yeah, but I can't find the exact, the correct window. That's the problem.
Share screen.
Sorry.
Let me know. Otherwise, if it doesn't work, I can get the presenter
try
rights.
I make my last attempt then.
Okay, let's do the last attempt. Otherwise, I can move it for you.
Just this one. But I don't see my. Okay, there it is. And now you see it fine.
Yeah, perfect.
Great. So, and as said, this was a research project and that we had where we, you know, the research project and the calls from the EU are very targeted, but since this was about obesity prevention among young people, we were very then eager to see how we could get involved young people, not as only as users, but to involve young people as a part of the whole project consortium. And there was, you see here from the just 2 overall objectives, just to have an idea of what this was focusing on, and just to demonstrate among the 2 overall objectives, the collaboration with the young people was the second one. And I just wanted to show this picture also because it's to underline the point and that we involved the youth organization already from the start, and the organization that we involved was Save the Children Norway. They have a youth branch called Press, and they were, as I said, there from the beginning, and we had extremely good experience with involving them in the project. But it was interesting at the time when we prepared the proposal, we actually struggled to find a youth organization that kind of fitted well into our project, because we were looking for an organization with a kind of broader perspective and not too narrow. So it took some time before we identified this one in Norway then. And in addition to then being a formal partner, the Press, the youth organization, there was a lot of activities then related to youth, and they were also then youth-led. So, for instance, there were youth alliances that were established around in the 5 project countries. Press organized a conference specifically on youth involvement, which was called Youth Matter. There was in Oslo, invitation to people around in different countries. We had a specific youth task force which developed their own declaration. They had conferences, and they also participated in our final conferences. So we tried to involve young people all the way through the process. I thought it would be interesting just to demonstrate also the value of the youth involvement, and this is just an example, because we did a lot of qualitative work with youth groups around in these 5 European countries, and one thing that we, for instance, focused on was we had a specific exercise focusing on the factors that involve or have an impact on young people's dietary behavior and physical activity, how they perceive it themselves. And as you see, this is just a map that came, an example of a map that came out of these exercises, and these are all the factors that one youth group in one specific school thought of, and the connection between the different factors. But the reason why I want to show it to you is that you see there are 3 circles there. And these are the 3 circles that are kind of targeted in the research literature when you see, when you look for factors that implement young people's dietary behavior, for instance. So when I refer to literature, I mean that studies that have been trying to identify, effectiveness studies as an example. But just by showing you this simple example, you'll see that there are so many other factors that young people think are important that is not captured by the literature. So I think this is also an example of the value of also having this input on the research itself, that you can kind of balance what the findings you will find in the literature against the perspective of the youth. Another example, then, as I mentioned, that we have this youth group. Then they created a kind of their own youth declaration, and this is kind of based, of course, we involved youth in different ways. Those who were more organized, they also formed this more core group, and they were the ones who developed this declaration. But I think that we also kind of allowed I think it's demonstrate also the project will to let young people kind of develop their own stuff by creating this youth declaration that they published, and where they had kind of, I think they came up with 3 kind of policy ideas that I think was important to be followed up. These are other examples from the project that the youth were very much involved in. You see there was both some kind of manuals that was developed by youth, and we also had this dialogue forum tool that was created by what should I say, a process designer, if that is a term. But this dialogue forum tool was also developed to kind of facilitate young people, for instance, a dialogue with policymakers or with other people in a way that kind of avoided having an uneven balance between the different people involved. So these are just more practical examples that also came from the project. And I think that to summarize the kind of key learnings there, that the project really, it benefited from having youth all the way. It was interesting, of course, that I think I lost the count of how many young people we were involved in along the way, because we had the same organization, but there is a natural turnover in the organizations. So due to the course of the 5 years of the project, they changed the leadership maybe each year. So we had new people to relate to, but it worked very well then, because it was kind of anchored in the organizations. And I think there are quite a lot of legacy from the project also, that other projects, like for instance the Joint Action PreventNCD, can learn and benefit from. And I think from the youth themselves, that the participation was kind of a way of also to build their own competence, and also even building network across the different European countries. And it was kind of a nice way of having the involvement. Finally, I just wanted to also refer to one of the publications that we had from the project. So this is we try to summarize all the research on youth involvement in policy process. And I think that some of when we went to the literature, we could see that at least of what is published, it seems like youth are particularly often involved when it's about the problem emergence. I mean, in the sense that, trying to involve youth to understand in the problem that is a target for policy, and also in the consideration of policy options. To some extent also the decision making, although this was particularly related to a policy related project, not necessarily policy in themselves. And we also tried to see in the research what level of involvement could we see in the published literature. And then it seems like, according to these 4 different levels from OECD, it was particularly on the consulting and collaborating part that the youth involvement was there, but not that much in, for instance, empowering, in the sense that we didn't find any kind of literature that's saying that youth have kind of been involved and had the leadership of things, which I think is also interesting. And finally, I just want to also point to the variety of engagement tools that are being used, and to trying to have youth involvement both in research project but also in youth development. So this was just the part from my side, just to have a kind of an insight in what we did in our project. So thank you.
Thank you very much, Arnfinn, for your presentation. The experience of Co-Create was indeed very valuable for several projects that followed after it. Now, without further ado, I would like to call to the floor also Mehitabel Holler from the European Heart Network to present us their experience of creating organized youth spaces called the EHN Young Hearts. Mehitabel, go ahead.
Thank you so much, Katja, and thank you so much once again for having me. It's a great honor and pleasure. Yeah, I mean, I'm very happy to actually be here to present this initiative. Maybe just a couple of words by way of presentation. I'm Mehitabel Holler. I'm Patient and Research Policy Manager at the European Heart Network, which is an NGO operating at EU level. Counting on the support of our network of member organizations from Europe, from EU, but also the broader European regions, and these organizations being heart foundations working with and for patients. Also, I mean, another comment about myself, I also happen to be a CVD patient myself, a young one, in the sense that I'm 27 and my journey started at 17. So it's very safe to say that this is also a project and initiative that is really close to me and really resonates with my experience. So the Young Hearts Task Force, Young Hearts for Friends, is an initiative that started as we realized that younger people are more and more affected by CVD. We gather more and more experiences that from people that started actually, unfortunately, the journey quite early. Yet the usual suspects seem still to be considered all the adults, which of course the incidence might be still larger, but this kind of approach risks to have young people still experience CVD to fall through the cracks. And also at the same time, we noticed that while we had many active and very excellent condition specific within the cardiovascular health realm, groups that have youth, young ambassador or youth groups, there was a bit of a gap when it comes to having a cross condition and comprehensive action, trying to look at the shared barriers and systemic gaps that a young CVD patient experience when starting and going through their journey. So this is I mean, besides my personal experience, of course, that play a role, but this is the need that we identified, and this is how this initiative started. So with this in mind, we set up a concept. I mean, not going too much into details of this, is just to say that we followed the EHN scope in terms of geography, focusing on the Europe region at large. And I mean, of course, focus area being patient voices and the entire pathway of their experience as CVD patients. And what we wanted to do was really to map what our needs as young CVD patients are, and shed a light on them, but also differentiate them from what older adults can experience when facing CVD. So that really that can be a focus and much needed attention on young specific challenges. And so the first part of our work basically focused on collecting these experiences and identifying these needs and putting them together in a resource. And we'll just talk about that just in a second. And the second now, starting now, so with this year, part of our work will be to actually join forces. So that's what we hope to do. And hopefully this webinar is also, I mean, another step in that direction, join the forces with the community and further help and join the discussions, also supporting the ongoing works at legislative level for One for All, the Safeguards Plan. But maybe more interest for this presentation, I just wanted to quickly talk to how in practical terms we did that, how we built this task force. First of all, in this sense, EHN started a bit advantage because we could count on our fantastic network of member organizations that operates at national level. So we could mobilize them and mobilize their patient community. So telling our members, please do reach out to your patient communities and launch a call for interest as we want to build this young patient group. We started with that. Then the individuals that were interested had first one-on-one call with me, and this was to address any burning questions first of all, but it was especially aimed at creating a safe space so that any sensitivity or any sensitive issue could have been shared in a safe space before before being brought to the broader group. So also to set a bit the expectation in a bilateral terms. And then once we collected a good number really of people interested, we kicked off the first meeting all together. So with all the volunteers that expressed interest in joining the task force. And what we did was to, we explained the why, as I did just now with you, but we also left the meeting quite open to patients to tell us basically what they were expecting from this, what they were actually, what their wishes would have been to in terms of what could have been achieved, what they needed to achieve, and what they expected to achieve through this group, and of course also any consideration in terms of the time availability, because this is also very important when it comes to establishing trust with the group. And on the very first day, from the very first kickoff meeting, it was extremely encouraging, as immediately everyone was very eager to share their experience, and immediately the challenges already emerged, and in terms of shared challenges in our journeys, and we were already able to identify things that actually characterized us all, unfortunately, as young patients, and we started immediately discussing potential solutions for this and brainstorming. And this brought us to actually the first big milestone of the group, which was the Young Hearts in Action. It's a set of recommendations that are based on the needs that were identified within the group. And this resource, which you can find online with the slides, you'll be able to access the link, but I can also share it in the chat later. You'll see that needs that are overarching across CVD conditions are identified, and some solutions are proposed in terms of what could be potential ways to address these challenges. So this was a great way to end the last year and to start the new one. And now in the new year, as I was saying before, what we're planning to do is to have these recommendations tested also within the community. Of course, the CVD community is the first. I mean, it's the most logical step, but they actually want to strengthen the collaboration also with the broader NCD community, because actually a lot of the challenges that we face as CVD patients are very similar to what other young patients are facing in other conditions. So we see this as really an opportunity to actually see where we overlap in terms of challenges, and where what solutions can be the best ones to actually make the best outcomes possible for young patients. And the first good collaboration that we kicked off this year was within the European Alliance for Cardiovascular Health, which is, EHN is a long-standing member of. And actually, with this effort of the Young Hearts, we managed to establish a youth-focused chapter within each, so as to make sure that the specificity of young people suffering from CVD are taken into consideration in the broader each agenda and works. But again, hopefully with this webinar and after, we're really looking forward to extend these cooperations beyond the immediate neighbors of the CVD space. This is for the task force itself. I just wanted to leave you with just a couple of tips, which by no means wants to be the golden rules, but I think in this experience, I think they were, for me, very important, and I think they could hopefully inspire for future works. And co-creation was already mentioned by Sophia, for example. It's very, and by Katja, of course, as well. It's very important, and it's important to start it from the very beginning. This is true for young patients, but in any patient and the public involvement, really, to make sure that you're not providing a package for patient to be recipients of or just disseminators of, but really being part in creating, so they can feel like they belong in the initiative. Of course, creating safe and supporting space, it's extremely important. Also, in terms of patients, they can have very specific sensitivities that can at times also hamper their capacity of joining specific projects, which is extremely important in the same sense, to make their participation as easy as possible. And whenever this is possible, for example, in the task force, we made it as flexible as possible. Just an example, not everyone that reached out to me were actually comfortable sharing their experience in the broader group. They preferred interacting with me, and then having me being the spokesperson within the broader group and the report back, which we decided to allow in order specifically to make sure that these people could still contribute in the way that they felt more comfortable contributing, so we could still count on their very, very important input. And finally, it sounds like a cliche, but really is showcase successes, because sometimes working in policy, we tend to close a chapter and move to the next task. And but really, when it comes to volunteers, patients that don't do this on a daily basis, it really can make a difference to see that the input they provided had a result, even the smallest result, but still celebrating every small success really makes a difference to keep the engagement high and the enthusiasm high. So this is something that a bit of a lesson learned that I see as probably the most important one when it comes to keeping up the engagement. And that's it for now. I'll leave it to that. I'm available for questions. And again, thank you so much, Katja, Ushka, Vigil, the fellow panelists, Carlos, everyone, for this very exciting opportunity. Thank you so much.
Thank you for presenting, Mehtabel, especially with all the efforts that went into creating the task force of the Young Hearts. And I think this is definitely very much important and comes into this grand scheme of youth engagement mechanisms that we've seen kind of pop up over the past 5 years with, for example, the World Health Organization's Youth Council, the OECD's YouthWise, the Youth Advisory Board for the EESC, and even the President of the European Commission, who just established about half a year ago her own President's Youth Advisory Board. So we're seeing that these organized youth spaces do bring additional value to the whole process, and having a kind of like a consultative reference group of young people who are focused on a certain area, such as health, does bring additional voices, diversity, and inclusivity into the mix, and helps bring those underrepresented voices to the governance and policy spaces that is much desired as well. So now, without further ado, we will jump into the Q&A. I have seen that we've already received quite a few questions in the chat, but I also would like to remind the audience that you have the opportunity to also unmute, and I'll give the floor to Urshka for further instructions.
Thank you, Katja, and thank you to all the panelists for really interesting presentations. Going at first to the questions we have already received, I would like to clarify. I think there was a question from Maxence Spritzi from the Diabetes Federation, if I'm not mistaken, who would like to also join the group. And if I understood correctly, otherwise, please, Maxence, feel free to also unmute and ask your question. He would like to also join more actively in the youth chapter inside the European Health Policy Platform, and also would like to thank Abigail, who also already offered some guidance how to join this platform and cooperate with us. But we will also explain a bit more about the youth chapter and about its activities further on during our webinar. The second question we have received was on the matter of Co-Create project on the obesity, and her question went in the direction if we're also thinking of tackling several other health issues within youth. Perhaps I know part of the answer, that since Co-Create has already finished, that some of its work from the Co-Create was then taken over by the Joint Action PreventNCD, inside which it's also the Youth Advisory Group that was today presented by Sofia. But perhaps I can still use this opportunity and ask Arnfinn, I hope you're with us, to also answer, perhaps if from your institution, if you're planning some further activities, projects that will work on that, and also address some other health issues together with young people. I'll give him a second, but otherwise.
Yeah, maybe while we wait for Arnfinn to connect, just to add on to the answer. So the Co-Create project was focused specifically on confronting childhood obesity as an issue, because it was a very, very targeted project. However, with with it being one of the very first examples that concretely integrated meaningful youth engagement into such a project that was EU funded. It was also, a trailblazing experience. It fed into the Joint Action Prevent NCD, and right now there are several projects that are currently being worked on or are in the proposal stages that would also address other health issues within youth, because it is important to consider that the funding of health within EU has been changed a little bit, so the scheme is slightly different, and it's going to be a little bit harder to tackle several health issues at once, and most of the projects will be kind of tackling only a few of those that overlap or will be specialized for a specific group of diseases or risk factors. So yeah, maybe just to kind of get us started with this.
Thank you, Katja. And we have in the meanwhile received also another question, which is not directed at a particular speaker, so feel free to answer to any of our panelists. And the questions were, how can you combat low disease risk perception in younger populations, and how can we balance that we're informing them and not inducing fear over these diseases? Yeah, Mehitable, go ahead, please.
Yeah, thank you, Oscar. If I may, that's a very fair question that we also tackle in our task force as well. Because of course you don't want people to be terrified of like living their lives, but at the same time we have the perception that sometimes when you're young you can do whatever, and like you don't necessarily see the consequences immediately, right? At the same time, sometimes when we go to the doctor, which was, by the way, unfortunate experience of most of our patients, you're told, but you're too young probably to have anything serious, so I wouldn't worry too much. Probably you're stressed, you're study too much, or you're stressed for the university or stuff like that. So I think it's important to raise awareness in the healthcare professional space as well, so that this perception is changed there, but also talk to our young population, also making them understand the consequences of some of the unhealthy behavior which target them unfortunately more and more often. For example, one easy one is vapes, right, or tobacco in general. This is, the marketing on young people is overwhelming at the moment. They're super attractive for young people, and they're actually, they convenient to use for some of them as well. You don't have to think about the smell of smoke anymore when you come back home to your parents. So that's the kind of things that we can work on to make sure that prevention starts early and they can be more aware of. So this kind of debunking the marketing that is happening also on social media towards this kind of products. And I mentioned tobacco, but it's really also alcohol and this kind of harmful really products that unfortunately people get hooked in very, very early in life. So I think that's one step towards that.
Thank you. Sophia, would you also like to add some thoughts to here?
Yes, I'm a geographer, so I'm very much into everything linked to environmental aspects and climate change, and also unhealthy living environments. And this question is very much also very central in these kind of discussions, because when we talk about climate change, there's also a lot of questions about climate anxiety and all things that link to mental health, and also just unhealthy living situations. And these are things that seem very small as we're talking about climate change. It impacts us on a long term and not exactly always at the moment, except if there is a very big climate event. But otherwise, it's on the long term, and also just question of longevity and how long it will take to actually impact us. So it's also important that youth know about it, like everybody gets involved, everybody talks about it, and especially if you are active in different organizations, youth organizations, and also just bigger organizations, the topics are better scientifically checked. The information that circulates is not only emotions, but it's actually facts also. So it also helps create a better discussion around the topic and not just having everybody having their fears thrown at each other and just listening to like, but one time this happened to me. It's more of a factual, everybody gets involved. And depending on, especially with youth, if you're active as at a younger age, you will get information that is pertinent for you and not just get everything thrown at you, but actually get it at a reasonable, feasible rate so that you understand what is going on, and also how you can comprehend and how that impacts behaviors. And this happens or works mostly with these kind of what was the word? Low risk perception and also younger population, because these are things that you have to teach younger kids and younger adults about how it impacts them long term, and not just something that happens directly. And that's when you realize you have to teach them, you have to be knowledgeable about it. And that comes through education, that comes through active participation, and also just discussions. Thank you.
Thank you for your answer. And I would also like, before reading the next question, remind everyone that if they want, you can also raise your hand and you will have an option to ask your question in person. We have another question from Maria, who is more interested in health literacy and inclusion on different levels. And she would like to ask Mehitobel, or also Sophia, if you want to answer, if you could redesign medical education so that young patients' voices shape the curriculum, what would that look like in practice? If perhaps you have thought of something that has been taught enough at schools, something that could be the best step to bridge the gap between healthcare professionals and young patients.
Yeah, no, that's an excellent question. Honestly, I mean, we could go on this, because I mean that there's really a need for that. I think, I mean, first of all, as Sophia actually just said, I mean, that you have to understand, it is really a need to understand going beyond disease diagnosis, but really living with the disease, and also the entire, what it means to actually have this long term, and the impact that has it in the quality of life, or really daily life, from education to work, and what it means in concrete also when it comes to treatment adherence and and rehabilitation. One practical example that we gather from our patient was that there, for example, in rehabilitation pathways, it was overwhelmingly dedicated to older people, which made them in the end extremely uncomfortable to join rehabilitation programs. For example, after a stroke, had very early in life, they found themselves in a room that didn't absolutely reflect them, and made them feel even at an extremely bad impact on their mental health as well, because they felt like, why am I even here? I don't, what happened to me shouldn't have happened at all to me. I'm too young. Look at who else is in the room with me. So that is impacts immediately the fact that they will not engage. So as a matter of fact, these people actually drop out of the rehabilitation program. So you know, to damaging, of course, the success of the rehabilitation, but also had a serious impact on their mental health as well. So these sometimes I have the feeling that these aspects of like what characterize young people and the stage of life they are, and the really what it means to contract a disease at a young age, means in the long term it's really missing there, and should be more present in the trainings for healthcare professional, and that should encompass really different areas. So from mental health, but also hormone therapy and women's health in terms of what is the effect on pregnancy, on family planning, or career planning, education. So these are aspects that are extremely important when you go to the doctor. You can speak, you feel that you can speak freely about these things that really make a difference.
Thank you, Mehtabil, for your answer. Maybe perhaps we can go in one more round of questions before going to the next part in our program. I would maybe ask both of you to reflect, or maybe from your experience, what would you add to the checklist if someone asks you, like, I want to do meaningful youth engagement? What was something that is stayed or maybe most memorable to you, that it's really important when you're doing meaningful youth engagement?
Do you want to go first, or
Sophia, you can go.
Yeah.
Okay, so one thing that often is not mentioned when you're doing youth, when you're a youth advocate, is that you're not doing it alone, because alone it's very hard to get traction, to get your message out there. So having, for example, as I'm a part of the youth advisory group, it's a group effort, and it's also important to have like-minded people next to you when you're trying to get something across. And it's something that this year I've learned very firsthand, that when you're working together as a group and you have one message, and that's how you'll get your message across. And it helps that you have a structure, it helps that you have funding, but if you don't actually have the passion and the drive to get it done, like just actually make a change, it becomes hard. And also, I'm not a person from the medical domain, so I've been also learning a lot. And it also helps that you have different perspectives. As I mentioned, like diversity helps and inclusion helps, because then you're actually making a difference, in a sense that you're making sustainable, inclusive differences that are long term, and that are actually making making good changes, not only bad changes, that you're actually making a difference. And something that I love about this generation of young people is that we're not afraid of stepping on people's toes. We are actually trying to make a change actively, loudly, and everybody should do that, because that's the only way that change happens. So large groups of people who are not afraid to disrupt is the best.
Thank you. Over to you, Mehtabil.
Yeah, I would very much echo what Sophia just said, and also from my perspective, I think it's extremely important to tell young people that it's fine sometimes not to know everything about things. Especially when they're patients, their experience is already extremely helpful and extremely impactful. Sometimes I get messages from people when I invite them to join this kind of webinars or other workshop, and they tell me, but I don't know enough, and that really, I mean, I take extra effort to explain to them that even just sharing their experiences, it's really extremely meaningful. But at the same time, it's important that whenever you get these kind of feedback, then you actually go back to these people and sit down and actually provide them training, so they can build more confidence, and they can participate with more confidence to actions. And we work in the field, so we can do so, and we can take this time to actually provide more training, or in how do you say, channel them to actually organization that can provide training so that they can build this confidence that they feel they lack, even though, yeah, I mean, it's not necessarily the case, but you know, you have to feel it as well sometimes to participate. So that's also a way to give them visibility and to put them really on the stage and have their voice amplified.
Thank you, Mehitabil. And with that, I give back the floor to Katja to guide us to the next steps.
Thank you, Urška, and thank you to the speakers for answering all the questions. We will now move on to the open discussion segment of our webinar, where everyone will be invited to kind of come in and contribute. And we will be discussing what are the next steps when it comes to the creation of the joint statement of the thematic network of the youth chapter on NCD prevention. And just to give us a few insights into what this joint statement is, how the drafting process works, and all of the nitty-gritty that we would need to know, I would call on Carlos from DG Santé to update us all about this.
Hi, good afternoon. Yes, so my name is Carlos and I work in Unit B4 in DG Santé, which focuses on health promotion and disease prevention, including the prevention of non-communicable diseases. Yeah, first of all, thank you for the interesting presentation and discussion. I think you highlighted the importance of meaningful youth engagement in NCD prevention. From our perspective, we very much value the initiatives like this one that bring young voices into the conversation and help move from symbolic participation towards more structured and impactful participation. Yeah, you mentioned a few examples of how youth engagement can work. We also wanted to mention we are also trying to integrate youth perspective in our work, and we are currently planning a youth breakout session on cardiovascular health during the European Youth Week on the 24th of April. I will share the link on the chat. Yeah, we are exploring the participation of some members of this thematic network and youth groups and organizations active in this space. The discussion will help inform ongoing reflections related to our work and including the preparation of a proposal for a council recommendation on health checks. And in that context, we also very much welcome the joint statement that the thematic network is preparing. I think it would be particularly valuable if it could highlight how the members of the network intend to take forward concrete actions themselves, and how these efforts could create synergies and contribute to the ongoing work of the European Commission and member states, including the implementation of the Seyhertz plan and the flagship initiatives. I think it would be also interesting to hear whether there are already any reflections on how the thematic network might continue its collaboration after the joint statement, and how the partnerships that we are building here today and they will be established through the process, how it could help sustain actions that members identify for themselves, and it would be important if the proposed actions on during this process and in the joint statement are realistic, they are sustainable, and especially ensure that the collaboration between members can continue delivering concrete results over time. Yeah, thank you.
Thank you, Carlos, for sharing with us what the joint statement means and what its purpose in the scheme of the European Union and the health policy platform itself. So in order to help facilitate this discussion, we prepared a couple of kind of like guiding questions that will help with the first drafting phase when we will be working on the first draft. And please also don't forget that if you join the EU Health Policy Platform and enter the Youth Chapter on NCD Thematic Network, you will also be able to join the drafting process. We will be posting about the next steps, the next meetings, and the drafting stages there as well. But for now, and feel free to raise a hand or answer in the chat, what would you say are some of the key areas we should consider as a youth chapter to consider including in our final joint statement? Do we have any volunteers who would like to share? And please don't forget, you can raise a hand and we will give you the floor. Yeah, I see Adam has raised his hand. Please go ahead.
Can you hear me now? Yes.
Yes.
Perfect. So thank you very much and congratulations on the great session. Sorry, I forgot I was putting in the video. So great to see you all and thank you very much for the session. So one of the things that I think could be very interesting to consider and something that I think that Katya and the whole young advisory group is actually, youth advisory groups has actually been doing, is actually to focus on cross-sector collaboration. Because I think that the prevention is something that is not based only on what happens within healthcare, but actually is something that is based on what happens between the different sectors and has not been tackled until now because we have not been able to communicate with each other in a way that we actually understand why what we are doing right now, even if we don't see the benefit right now, it's actually something that is going to make a very big difference in the long run. So I think that cross-sector collaboration is something that would be essential to have as part of it.
Thank you so much for sharing that. I completely agree, especially thinking about the sectors that are very closely related to young people's development and growth, like education and stuff like that would be very, very important to consider. And then also seeing where the interconnections between the different sectors are so that we don't work in silos, because youth engagement is also a very non-siloed approach. So it is definitely important to consider that. Now I see that Stefan is also raising his hand. Stefan, go ahead.
Hello, can you hear me?
We can.
Okay, I will turn on my camera. Just 1 second. Can you see me?
Yes, now we can.
Okay, first of all, I'd like to thank you for the opportunity to speak. What I would like to add personally is that I believe that we should also communicate more directly with the youth, whether it's via internet channels or in-person events. I do think this is very important to get them more involved with us, to know what are the next steps they should take. And also I do believe it's very important that in this way we'll engage more with the youth, because sometimes I do believe that getting ordinary people involved is also very important, not just stakeholders, to get our message across, to get more people involved, and also to have more impact. So I do believe this is very important, and I do believe that we should focus more on the current diseases that are impacting us right now, whether it's obesity or pulmonary diseases. This is a very current thing going on in where I live in North Macedonia, especially during the winter, where it's very polluted because of factory pollution and vehicles. So I do believe that we should focus more on that approach, and I do believe that we should approach young people more directly. That is it from me.
Thank you, Stefan. Again, very much in agreement with you. And I think this is also the purpose of the youth chapter, to kind of find this two-way approach where we at the same time bring the expertise that is being developed by the chapter members to disseminate it as widely amongst the European youth as we possibly can, make it relevant, make it youth friendly and also palatable for them to use, to understand, and so on. But at the same time, to also offer ways on how to get, young people to infiltrate those policy and governance spaces where decisions are being made, so that we have more representation on that side. Because if we are doing both top-down and bottom-up approach, we will hopefully meet in the middle and be even more successful. So doing both a systemic and structural change, while also working at the grassroots level with the activists and advocates that are doing such a wonderful job in the youth space around the different countries. I also see that we have a lot of input in the chat, so I will just go ahead and read it out. We have a thought from Alina saying that the youth chapter should also include digital technologies that are currently used and will be developed in healthcare. Definitely in agreement with that. That is also something that ties us with the Safe Hearts plan, which does make mention of digital technologies, and we can probably expect that the digital determinants of health will be mattering more and more as we go into the future, with so much of the life aspects being moved on into online spaces. Then we have some input from Elsie, saying that it will be important to have champions in different areas and countries so they can take learning back to the community. Again, very much in support of this statement, and these champions, at least when it comes to me, they can come in all shapes and forms, sizes and ages. So I wouldn't necessarily say just having youth champions, but maybe also champions of youth would also be important to have in different arenas. Then we have a thought from Antonio, who is also a new YAG member within the Joint Action Prevent NCD, and he believes that we should place more emphasis on intergenerational action, including initiatives such as Healthy Cities, so that our work is not limited to collaboration among young people only, but also shows that youth engagement is at its core to community engagement. Again, a very, very good thought, and something that we will be including in the joint statement, which is the community approach, because technically youth engagement is just a subcategory of the broader social participation aspect. And making use of different networks such as Healthy Cities or Healthy Schools even is something that we can definitely utilize to spread the message even further. Then continuing with Elsie, talking about the youth program and the difficulties to recruit, and we need to work on getting away from the stigma of being a health advocate to make it more open and friendly and just to engage with no pressure. That is also something to be considered, something about the safe spaces and the safeguarding of the health advocates, not just from the side of becoming one, but also when you're already being a health advocate or activist, how can you get protected from the so-called activist burnout? Because oftentimes when you step into these spaces and you get disillusioned pretty fast, because things and change doesn't happen as fast as we would like it to. At the same time, spending a lot of free time on this can also lead to additional mental health impacts, even physical health ones. So we need to do protection and prevention at the same time. Going on to Anna's input, and I think it goes in line with what I just said. She said that emotional health in young people is very important and transversal issue that could be implemented. So within the future project in Merck, they have data and proposals from youth on these topics. So Anna, please feel free to share it. And if you join the youth chapter, you can just post the resources there so that we can gather as much of the different policies, materials, and so on that we can then refer to in the joint statement. Then going to Dana's input, she adds that comprehensive documentation of youth involvement is also crucial. That includes the quantifying impact, and that is the language of most policymakers, industry, and so on. again, a very important message as well, especially because most of the young people's work goes kind of like undercover, is not very visible and recognizable, especially because it doesn't get posted on the scientific channels or as different articles and so on. So that is also why this webinar is highlighting different experiences that people had. And then hopefully we can get people to recognize youth efforts even through various different other ways, or allow opportunities where young people can get access to those spaces and actually make their work visible to the policymakers and the industry. So yeah, we need to figure out a way on how to document it well and translate it in a way that will be accessible also to these other stakeholders that we're trying to reach. And maybe I'll now give the floor to Mehitabel and Sofia, because they also posted a few really good thoughts in the chat, but I think they deserve to also be spoken out loud. So Mehitabel, do you want to go first?
Thank you. I didn't want to monopolize too much, so that's why I put it in the chat. But I mean, and I realized I didn't write it even properly. But yeah, I mean, I wanted to stress that sometimes, you know, of course, gender age responsiveness, it's of immediate importance, but sometimes we also miss a bit the gender side of things. Especially when it comes to health transitions. I mean, they starts at very young age, and what we also seen a lot is that we transgender people are not very rarely considered in across conditions and in the research projects. And yeah, I mean, they're just a segment that is simply underrepresented, and it's a reality of things, and it has an impact. It can have an impact on treatment. It can even have an impact on disease, and vice versa. So there needs to be this emphasis put there, and yeah, spotlight. And also it's the same thing also when it comes to hormonal treatment for women, being that for contraceptive or simply for other conditions, and that also should be something that is, you know, that should be seen as overlapping with NCDs, and not simply as a completely different topic, as it has interactions there that should be understood and yeah, and looked into.
Yeah, completely agree. That intersectionality is crucial to be considered, and really bringing to the forefront all of the issues that are kind of like connected to the youth engagement in a nutshell. And now maybe going also to Sophia for her thoughts.
This was more just a very small thing. I'm not going to take too much time because everybody has very good thoughts, but also maybe ask or demand or just try to find money for youth engagement, in the sense of, because as mentioned before, it's done on our own time. It is done for free. It takes a lot of energy. It takes also a lot of brain space, and it impacts mental health very much, especially when we're trying to advocate for something. There's also something we've been talking about internally for the youth advisory group, is for more funding for youth, because as mentioned previously, that they're mostly like students or young professionals who don't have the time, the money to put this much time and energy into this project. So maybe see if there's grants or funding that will help promote this, because as mentioned, youth engagement is the future. It is the basis, the foundation of sustainable practices. It gets almost everybody's opinion, experience, lived experience, thoughts, and everything. So it's very encompassing, but due to lack of opportunities, lack of funding, lack of possibilities, it also makes it very hard. So something that could be also to kind of like as a more logistical approach to youth engagement and in the joint statement is to, because we're talking about the whole of society, and youth of today will be the older people of tomorrow. So we are still very much important stakeholders and important members of society. So it would be interesting to see this also as prevention, to invest in youth, or not just get their opinions, but also monetarily invest to get better outcomes later on.
Yeah, I think that is a very valid point as well. We could potentially even consider some of the other recommendations that we could create that kind of tackle these like structural changes, for example, when it comes to different grants and so on, that if they're already, you know, mandatory fields that you need to kind of fill out, like sustainability, communication, and so on, why would social participation not be considered one of them? And maybe that way, by including youth, patients, people with lived experience, so civil society, and so on, maybe your proposal would get extra points just by doing that. So yeah, we will definitely also try to find ways on how to incorporate these other solutions and recommendations into the joint statement. But now, just to kind of give an insight into what is coming next, in the youth chapter on NCD prevention on the EU health policy platform, over the next couple of weeks, we will be collecting input that is answering the following questions. So what are the main barriers to meaningful youth engagement in the EU health spaces? What are the enablers of meaningful youth engagement? And then also, what should be the key asks by the thematic network? And in order to create the joint statement, we need everyone's help, everyone's involvement. So if you're already a part of the thematic network, thank you. I hope you will remain a partner in this process. And if not, please consider joining it. The more, the merrier. Because the more brains that we can put together to this, the more impactful the joint statement will be. And maybe just to kind of do an overview of what is coming up next as we come to the end of today's webinar. First of all, I would just like to sincerely thank all of our speakers for their valuable insights, and of course, all of the participants joining the webinar and contributing to this important discussion. And I think that today's conversation highlighted a central message, and that is that if we want effective and sustainable prevention of non-communicable diseases, we also need to make sure that young people are not just consulted, but they must be meaningfully involved in shaping of the policies, of the programs, and of solutions. And the webinar also marks an important step in the work of the thematic network, particularly as we move forward with the development of the joint statement. So as I mentioned, as the next step, we will officially launch the drafting phase of the joint statement, and in the coming weeks, an initial draft will be developed through the EU health policy platform. And hopefully this draft will reflect many of the ideas and perspectives shared today, including the key principles for meaningful youth engagement and, of course, some concrete recommendations for policymakers, civil society, and other stakeholders. Now, all members of the thematic network will be involved to participate and contribute their feedback. And since this is a collaborative process, we strongly encourage everyone to actively engage. And whether that is by proposing edits, sharing examples from your own work, or highlighting priorities that should be reflected in the final document. Following this consultation phase, the drafting team will then consolidate the inputs and prepare a final joint statement, which will be presented later this year. And the aim is for the statement to serve as a collective call to action on strengthening youth engagement in NCD prevention across Europe. So we hope that many of you will continue to be part of this process, will help shape a strong and impactful statement that reflects the diversity of experience and expertise within this community. So once again, thank you for your participation and your commitment for advancing youth engagement in health policy. If you have any policy briefs, documents, manuals, toolkits, any resources whatsoever within your organization, or maybe you came across it through any other means, all will be welcome if you post them on the thematic network. We will do a collection of this of these resources and strengthen our library, and we will use all of that in the drafting process as well. So I wish you a wonderful rest of your day. We hope to stay connected in the next steps of the thematic network, and hopefully see you on the EU health policy platform or at our next webinar. Thank you so much.